I'm going to tell you during this presentation, I'll first tell something about myself, then I'm going to introduce you to the hospital information system, the process improvement, hospital information system workflow, development process, integration process, risk workflow, that's radiology information system, and then we will have a conclusion. So, as Kemal said, I have a degree a master degree from University of Electrical Engineering in Sarajevo, and I'm currently part of Authority Partners team, a pioneer company in Agile software development in Bosnia and Herzegovina, and I work there as a program manager. And my previous employment was a senior associate in healthcare application support department at company Medit, focused on healthcare information systems. So I have successfully worked on various projects, each of them bringing better and safer patient care in hospitals and clinics around the world. So this is something about healthcare and healthcare progress. So healthcare progress in our environment requires the implementation of advanced IT and development techniques. So new healthcare trends go towards digitalization of patient records, patient cards, imaging, prescriptions, portal for patient assurance, and etc. And the software that supports all of that is becoming increasingly complex. Okay. So for this, we are going to use Agile approach in the software development with special emphasis on a Scrum practice. So we can say that a good healthcare information system is necessary to manage a health organization with efficiently and effectively. So hospital information system, we can say it has a definition. It's a comprehensive integrated information system designed to manage administrative, financial, and clinical aspects of the hospital. There are many advantages of Agile methodology over the others when it comes to hospital information systems. But we will say the first of all is the place of development is better, and the second one, the quick response to the stakeholder needs, and we can implement all those changes, and all new features can be implemented at the beginning on development. I will talk about patient values, because the main purpose of hospital information system is the patient value and the patient outcome. So the first question when we want to create and develop and implement hospital information system is, how will we improve patient experience and outcomes and satisfy the needs of other stakeholders? We can say the stakeholders that work in a hospital, they are getting to know the information systems, and they don't always know what they want at that moment. So you need to collect all the data needed to develop hospital information system. So how do you do that? You need to go there, you need to have meeting face-to-face with all the stakeholders, you need to collect all the data. So first of all, you need to understand the whole process. You need to understand how hospital information system functions, and does it have some subsystems that are integrated. So we have here, you can see, radiology information system, pharmacy management system, laboratory information system, emergency management system. That is all part of hospital information system. We have some other modules like billing module, reporting module, insurance module, registration model for the patient. So everything needs to be considered before implementing the hospital information system. Here's the list of all the systems that are involved in hospital information system. For example, we have administrator maintenance system, drugstore house, wards, outpatient system, inpatient system. The ward system, we already mentioned it, human resource system, billing system, drug system, so all needs to be covered, and it's very long-term. It's a long-term process and very complicated, and each developer needs to understand each of these systems, how it functions and how it can be developed, and the overall process of it. So this is a hospital information system workflow. So how it begins. First of all, you need to understand that there maybe it's developed patient portal, or if it's not developed, then a patient comes to the hospital. He needs to have an appointment with a nurse. So nurse is scheduling the appointment for the doctor. So the patient needs to address to the nurse. So he needs to give his demographic data so she can enter in a patient registration form. After she entered the patient registration form, she needs to enter some medical history from the patient, and after that, there's an admission screen. That admission screen is contained of the fields that are necessary for the doctor and for the patient and for the whole hospital, because later it will be used for reporting purposes. After that, when the admission screen is filled in, the nurse has evaluated, so the patient will go to the work list of the doctor, and he will enter the department where the nurse has admitted him. So the doctor will perform his exam, he will write the exam form that needs to be written, he will order some investigation if there is a need for the patient, some laboratory tests, radiology screenings, and etc. Then he will order some prescriptions, he will fill in some prescriptions, and then there's billing, and after that we have reporting. So each developer needs to understand all of these aspects so he can develop all those screens, all the features need to be developed. So, as we said, the first step is going, for example, product owner will go to the stakeholders, nurses, doctors, management team, technician team, and he will seek for the information. So he needs to gather all the information relevant for the hospital information system, all the exam forms, all the order forms, all necessary data that has to be filled in, so he can share it with the development team, and they can start on development and on design for implementation. After that, there's the staff education and training, and when everything is done, we are getting feedback and requests for changes. So, where it begins, this is, for example, patient registration data, and it's a patient registration screen. So, few fields are mandatory fields. For example, NPI, National Patient Identifier, we have a date of birth, patient name, patient last name. Those are sensitive data, and once they are entered, they can't be changed because they can be misused. So we need to take care of that as a first step. After that, there's an admission screen. So admission screen depends on the type of the care that patient is going to need. For example, we have inpatient care, we have outpatient care, we have laboratory systems, laboratory usage, we have radiology screen, radiology admission. So all those admission screens are different. It needs to have a name of the doctor who will perform the exam. It needs to have a field where you need to enter the diagnosis for the patient. And diagnoses for the patient are usually an ICD-10 catalog that is used for all world organization. So it looks like this. I have here ICD-10 structured data format. So we have a category of code, we have etiology, extension, site or severity. We need to take into consideration that it has to have some insurance data there, because when we implemented here, for example, in Bosnia, we implemented that because some insurance companies are covering patient care and some of them are not. So there's participation of the patient. Maybe there's a 0% participation, there's 50% participation, there's 80% participation. We need to take those participation into consideration. And there are other fields that are very important to fill in. So you need to get all those information from the doctors, from the nurses, from the Institute of Insurance Health, and you need to put them in that admission screen. When that is done, we have the first phase done, and it can go to trial. So we will deploy that first phase, and we'll see how it goes. So when it comes to the doctors, we are getting feedback from their side. So they are telling, okay, some field is missing, some field maybe it's not necessary to fill in. So we are gathering all the feedback from them, and you are amending the changes. And after that, you are putting, again, you are deploying that second phase of development. You are deploying that, and you are putting it on the trial again. So it's a process for 2 or 3 months. After that, you need to integrate your system, that first phase of the system, you need to integrate it with other systems that are already in the hospital. For example, you have a patient screen with patient demographic data, you have admission screen with all necessary data, but you need to integrate with, for example, accounting system, because when the patient enters in a hospital and he performs some procedures, some exams, you need to bill him. And the only way is that you integrate that hospital information system that you develop with accounting system using ID or something that you have developed, so you can create reports and bills. For integration with other systems, hospital information system is known for using HL7 standards and ICOM standards. So HL7 standards and ICOM standards are standard type of messages, and they have a standard type of fields. Depends on the process and depends on the action that you have made. For example, when you are entering patient registration form, HL7 message is created with all the data that you have filled in that screen for patient registration data. There's another message different from the first one when you are entering admission screen for the patient, so that we have another message created and sent to the gate, sent to the database, depending what you have set up. For all these messages, standards, and integrations, you need to prepare your database for it. For example, if you integrate 2 systems and you are creating HL7 messages, maybe that other system will not support HL7 messages. So you need to have a gate or database in the middle so it collects all the data and transforms it into structural data so each system can read it, and after that you can pull all kinds of reports that you need for higher management. Regarding integration, there are different systems, like I said. There are imaging system, PACS. It's a picture achieving and communication system. We have other clinical systems. We have material management system. There's a prescription system too, where you need to integrate it with the pharmacy. So I'll get back to it later in my lecture. So like I said, there is a subsystem for hospital information system. It's a radiology information system. Radiology information system is a very complex system. As I said earlier, it is a part of hospital information system. And I will explain you the workflow, and then we can come back what each of developer needs to do for this to be implemented. For radiology department workflow, the registration form for the patient, everything is happening in his hospital information system. So all data are passed to the radiology information system when the orders are made. So the patient comes to the nurse is scheduling the exam. So when the patient comes to the workflow of the doctor, work list of the doctor examines him. He performs some procedures. If there's a need, he orders some investigations, like I said, laboratory or radiology in this case. So to perform radiology investigation or radiology screen as you want, he needs to place an order to some radiology department, MRI, CT, X-ray department, doesn't matter. So he needs to fill in the order. In that order, he needs to put all the procedure that needs to be done for that patient. So the order comes to the work list of radiology information system, and the technician is creating a new form for entering the patient to the work list of radiologists. So when the patient comes to the radiology work list, he is transferred to the modality, as you can see there. He's transferred to the modality, and the modality is integrated with the system, with the CT, MRI directly. So when the patient is scanned, all the pictures that are coming, they are coming to that modality. So the patient name, the patient ID is connected to that picture. And after that, those pictures can be printed to a film, what was used, and now technologies, they are putting those images in the image manager and archiver. So it can be presented later if there's a need for studies, and if there's a need that a doctor needs to investigate something, or to look just in the scan, in the picture, and etc. So this is the basically workflow. So what is the part of development team here? Like I said, he needs to put patient information screen, he has already done it. Admission screen, he has already done it. But for these kind of screens, admission screen can't be done for a radiology department if there is no order for that. So the development team needs to develop the order form for the appropriate exam form for the radiology department. So he needs to think about what fields he needs to develop, what type of fields are mandatory, does that need to be connected with some other fields, with some billing accounts. So when a procedure needs to be performed, there are a lot of different aspects of it. For example, technician needs to, physician is choosing a procedure that needs to be performed for that patient. But that procedure needs to follow some material that will be used for that exact procedure. And those materials need to be connected with the billing codes so it can be built later when it needs to be built. So we need to take, at the beginning of development, we need to take all those steps into consideration so we can develop that screen. It's not as simply as it looks, but it can be when you put your mind into it and when you understand the whole overall process of radiology workflow. As a response to that order, to that procedure and performance, the doctor is entering the exam form. So what is the exam form? It's basically what is opinion of the doctor of that. So, for example, there are some mandatory fields, what he needs to populate, like diagnosis for that patient. And there are some free text that he can put his opinion and his conclusion at that moment. But a radiologist will not interpret that opinion to the patient. No, the patient will go to his physician in the primary care. So the primary care, the physician in the primary care can see those results and can tell the patient if there's a need for other prescriptions, for other investigations or not. So that is the workflow that needs to be interpreted, that needs to be developed. And all those exam forms, order forms, needs to be put it in some safe place so the other system can reach them. So you need to create a simple database or simple archiver just for those type of exams, those type of orders, and etc. When we are finished with everything, when developing exam forms, order forms, and then it comes the need to integrate with other systems. Then we have an electronic prescription, e-prescription, as we call it. So you need to integrate hospital information system with a pharmacy system, and it's a very demanding job. So you need to take in consideration there's a different process there on the pharmacy side, and there's different process here on the hospital information level. You need to take in consideration the participation of the patient and the health insurance status of the patient. So you need to integrate, besides the pharmacy system, you need to integrate it with the systems that are in Institute of Health organization. Basically, the e-prescription, when a primary care physician prescribes a prescription, that prescription, you can use web services, you can use HL7 messages, whatever type of API call you can use, so you can transmit all data needed to the pharmacy system. So when the pharmacist comes to wants to check if there are any medicine for that patient, she will just need to enter his NPI, so she'll find him and she will check, okay, if he's insured and if his insurance covers the whole bill, the patient will not pay, and if not, the patient needs to pay. So the data for that patient needs to be in real time, and to be in real time, you need to integrate that with a management system in Institute of Health. So, for example, if a physician has prescribed some medicine 2 days ago for that patient, and that patient was insured, but today he comes to the pharmacy and wants to collect those medicines, he's not, at this day, he's not insured anymore. So you need the real-time data. So the pharmacist, when he checks the NPI of the patient, he can see at that point if he's insured or not. If he's not insured at that moment, patient needs to pay. If he is insured, he doesn't need to pay. Oh, sorry. Okay, so the conclusion of everything. So yes, Agile development has a role in the healthcare IT development. Why? There's a customer satisfaction by rapid delivery of useful software, welcome changing requirements even late in development. Working software is delivered frequently. Working software is the principal measure of progress. Sustainable development able to maintain a constant pace, close daily cooperation between business people and developers. Face-to-face conversation, projects are built around motivated individuals, and simplicity and self-organized teams. So yes, Agile is very important in healthcare industry, and this is how we do it. Thank you very much for everything. I hope I was clear enough, because the whole process is very complicated when you listen it for the first time. So I hope that you understood it just a little bit. Thank you.